41. A patient with a seizure disorder should be taught to avoid alcohol. True or false? Answer: true. Rationale: alcohol can lower the seizure threshold and interact with anticonvulsants, increasing seizure risk, requiring patient education per epilepsy management guidelines. 42. The Romberg test is used to assess cognitive function. True or false? Answer: false. Rationale: the Romberg test assesses balance and proprioception, not cognitive function, which is evaluated with tools like the Mini-Mental State Examination per neurological assessment. 43. Mannitol is used to reduce intracranial pressure in brain injury. True or false? Answer: true. Rationale: mannitol, an osmotic diuretic, reduces intracranial pressure by drawing fluid from brain tissue, used in acute brain injury per neurological emergency protocols. 44. Stroke symptoms always resolve within 24 hours. True or false? Answer: false. Rationale: stroke symptoms may persist, causing permanent deficits, unlike a TIA, which resolves within 24 hours, requiring urgent evaluation per stroke management guidelines. 45. The nurse should monitor for orthostatic hypotension in patients on antiparkinsonian drugs. True or false? Answer: true. Rationale: antiparkinsonian drugs like levodopa can cause orthostatic hypotension, increasing fall risk, requiring monitoring and patient education per pharmacology principles. 46. Meningitis is always caused by a viral infection. True or false? Answer: false. Rationale: meningitis can be caused by bacterial, viral, or fungal infections, with bacterial meningitis being more severe and requiring urgent antibiotics per pathophysiology. 47. A patient with a spinal cord injury should be turned every 2 hours. True or false? Answer: true. Rationale: turning every 2 hours prevents pressure injuries in patients with spinal cord injuries who have impaired sensation and mobility per wound care protocols. 48. Beta blockers are the primary treatment for epilepsy. True or false? Answer: false. Rationale: beta blockers treat conditions like hypertension, not epilepsy, which is managed with anticonvulsants like levetiracetam per treatment guidelines. 49. Aging increases the risk of Alzheimer's disease. True or false? Answer: true. Rationale: age is the greatest risk factor for Alzheimer's disease, with prevalence increasing significantly after age 65, per epidemiological data. 50. The nurse should administer aspirin during an acute ischemic stroke. True or false? Answer: false. Rationale: aspirin is used for stroke prevention or after stabilization, not during an acute ischemic stroke, where thrombolytics or other interventions are prioritized, per stroke protocols. 51. The nurse should monitor for constipation in patients with Parkinson's disease. True or false? Answer: true. Rationale: Parkinson's disease impairs autonomic function and slows gastrointestinal motility, increasing constipation risk, requiring dietary and medication management, per nursing care plans. 52. A Glasgow Coma Scale score of 15 indicates severe brain injury. True or false? Answer: false. Rationale: a Glasgow Coma Scale score of 15 indicates normal consciousness, while scores of 8 or less suggest severe brain injury, per neurological assessment standards. 53. Multiple sclerosis can cause optic neuritis. True or false? Answer: true. Rationale: optic neuritis, inflammation of the optic nerve causing vision loss, is a common early symptom of multiple sclerosis due to demyelination, per clinical presentation. 54. All seizures require immediate administration of phenytoin. True or false? Answer: false. Rationale: brief seizures may not require phenytoin. Benzodiazepines like lorazepam are used for acute management, with phenytoin for maintenance, per seizure protocols. 55. Alzheimer's disease primarily affects short-term memory in its early stages. True or false? Answer: true. Rationale: early Alzheimer's disease impairs short-term memory due to hippocampal degeneration, while long-term memory remains intact initially, per disease progression. 56. A CT scan is the first-line imaging for acute stroke. True or false? Answer: True rationale. A non-contrast CT scan is the first-line imaging for acute stroke to differentiate ischemic from hemorrhagic stroke, guiding treatment per American Stroke Association guidelines. 57. Myasthenia gravis symptoms worsen with rest. True or false? Answer. False rationale. Myasthenia gravis symptoms, like muscle weakness, improve with rest and worsen with activity due to acetylcholine receptor dysfunction, per clinical features. 58. The nurse should avoid suctioning a patient with increased intracranial pressure. True or false? Answer. True rationale. Suctioning can increase intracranial pressure by stimulating the vagus nerve or causing hypoxia, requiring cautious use or alternative airway management, per neurological care protocols. 59. Status epilepticus is a medical emergency requiring immediate intervention. True or false? Answer. True rationale. Status epilepticus, a seizure lasting over 5 minutes or recurrent seizures without recovery, risks brain damage and requires urgent benzodiazepines, per emergency protocols. 60. Parkinson's disease is caused by a genetic mutation in all cases. True or false? Answer. False rationale. While some Parkinson's cases are linked to genetic mutations, e.g., LRRK2, most are idiopathic, with environmental and genetic factors contributing, per pathophysiology. 61. A patient with a traumatic brain injury should be kept in a quiet environment. True or false? Answer. True rationale. A quiet environment reduces sensory overload and agitation in traumatic brain injury patients, promoting recovery and preventing seizures, per neurological nursing care. 62. Antidepressants are the primary treatment for epilepsy. True or false? Answer. False rationale. Antidepressants treat depression, not epilepsy, which is managed with anticonvulsants like levetiracetam or valproate, per treatment guidelines. 63. Stroke patients are at risk for aspiration pneumonia. True or false? Answer. True rationale. Stroke can impair swallowing, dysphagia, increasing aspiration pneumonia risk, requiring swallowing assessments and modified diets, per stroke care protocols. 64. The nurse should administer mannitol to all patients with seizures. True or false? Answer. False rationale. Mannitol is used for increased intracranial pressure, not seizures, which are treated with anticonvulsants or benzodiazepines, per pharmacological protocols. 65. Guillain-Barré syndrome can lead to respiratory failure. True or false? Answer. True rationale. Guillain-Barré syndrome's ascending weakness can affect respiratory muscles, leading to respiratory failure, requiring mechanical ventilation, per clinical progression. 66. Alzheimer's disease is fully reversible with early treatment. True or false? Answer. False rationale. Alzheimer's disease is progressive and not reversible, though medications like donepezil may slow cognitive decline, per disease management guidelines. 67. The nurse should monitor for gingival hyperplasia in patients taking levodopa. True or false? Answer. False rationale. Gingival hyperplasia is a side effect of phenytoin, not levodopa, which is used for Parkinson's and may cause orthostatic hypotension, per pharmacology. 68. A transient ischemic attack increases the risk of future stroke. True or false? Answer. True rationale. A TIA is a warning sign of transient cerebral ischemia, significantly increasing stroke risk, requiring preventive measures like antiplatelets, per stroke guidelines. 69. Multiple sclerosis is diagnosed primarily through blood tests. True or false? Answer. False rationale. Multiple sclerosis is diagnosed via MRI, lumbar puncture, and clinical evaluation, not blood tests, which may rule out other conditions, per diagnostic criteria. 70. The nurse should place a patient with meningitis in droplet precautions. True or false? Answer. True rationale. Bacterial meningitis, e.g., Neisseria meningitidis, requires droplet precautions to prevent transmission via respiratory secretions, per CDC infection control guidelines. 71. All patients with Parkinson's disease develop dementia. True or false? Answer. False rationale. While some Parkinson's patients develop dementia, it is not universal, with risk increasing in advanced stages, per disease progression. 72. The Romberg test assesses cerebellar function. True or false? Answer: true. Rationale: the Romberg test evaluates balance and cerebellar function by assessing proprioception and coordination, with swaying indicating dysfunction, per neurological assessment. 73. Amyotrophic lateral sclerosis is caused by a viral infection. True or false? Answer: false. Rationale: ALS is a neurodegenerative disease with genetic and environmental factors, not a viral infection, causing motor neuron degeneration, per pathophysiology. 74. The nurse should monitor for urinary retention in patients with multiple sclerosis. True or false? Answer: true. Rationale: multiple sclerosis can impair bladder innervation, causing urinary retention or incontinence, requiring monitoring and catheterization if needed, per nursing care plans. 75. A lumbar puncture is the first-line diagnostic test for stroke. True or false? Answer: false. Rationale: a CT scan is the first-line test for stroke to identify hemorrhage or ischemia. Lumbar puncture may diagnose conditions like meningitis, per stroke protocols. 76. Seizure precautions include padding the bed rails. True or false? Answer: true. Rationale: padding bed rails prevents injury during seizures, part of seizure precautions along with clearing hazards and ensuring airway safety, per nursing protocols. 77. Huntington's disease causes choreiform movements. True or false? Answer: true. Rationale: Huntington's disease, a genetic disorder, causes choreiform, jerky, involuntary movements due to basal ganglia degeneration, per clinical features. 78. The nurse should administer thrombolytics to all stroke patients. True or false? Answer: false. Rationale: thrombolytics are used for ischemic stroke within a specific time window, not hemorrhagic stroke or outside the window, per American Stroke Association guidelines. 79. Peripheral neuropathy can cause a burning sensation in the feet. True or false? Answer: true. Rationale: peripheral neuropathy, often from diabetes or chemotherapy, damages sensory nerves, causing burning, tingling, or numbness in the feet, per clinical presentation. 80. All migraines are triggered by stress. True or false? Answer: false. Rationale: migraines can be triggered by stress, but also by factors like hormonal changes, foods, or sleep disturbances, varying by patient, per migraine management guidelines.